as you exercise and as you do things. We'll capture it, we can keep up with it. And then you bring in the whole social networking implication of this, where you hit a button and you're going to have a group of people here, and it'll tell you everyone that is part of your social group that is into the walking mode around you at that moment in time. All of this stuff links together. Spectacular. Nice picture, too small to read, so I won't spend any time on that. So basically, at the end of the day, healthcare costs are high, they're rising too fast. They're a result of negative health behaviors. It's really that simple. That is the problem. That is the problem. There are lots of problems, but that's the problem. Sustainable behavior change, powered by data that's personalized, actionable, and digitally available in real time, is the answer. Lower cost and better outcomes as a result. And basically, we think that's all sort of wrapped up in this idea of lifelong well-being. In other words, have some fun. We've been working at this for a while. Look at the seniors on the bottom right. We have dance programs for these folks. We have games for them. And basically, fun things healthy. We've been big into the bike world and trying to educate and communicate. We're moving into the communities with retail storefronts where we start bringing together people for social interaction and all those aspects. So we're really all over trying to make fun things healthy and healthy things fun. And I know it sounds a little out there, but you know, we try to be out there and we work pretty hard at it. And sometimes we actually make it. So thanks for having me today. Enjoyed it.
Despite their best efforts, these panelists have not received any advance notice about the content of Mike's presentation. Now, I could have been a very rich man in the last 3 days based on what they were willing to pay, but they've not seen the slides. They viewed it the same time you and I did in the last hour. So what I've done is I've asked them to each give us their personal, extemporaneous comments in under 10 minutes each, and they're not speaking as representatives of their schools, and I'm going to introduce them more properly in a moment, but as experts in the field listening and reacting to what Mike had to say. Following their remarks, if we have time, I may ask Mike to come back up to the podium and make some responses to what he's heard from our reactors. Well, typically, we try very hard to get broad representation from across our campus and from our intellectual community for the reactor panel. As I noted earlier, despite Christine Aronson's name in the program due to illness in the family, she's not able to be here, but we've been able to assemble a wonderful group. So Janice Burke is the Dean of the Jefferson School of the Health Professions and also chair of their Department of Occupational Therapy. Becky Finley is the founding Dean of the Jefferson School of Pharmacy, and Mary Shaw is the Dean and Professor of the Jefferson School of Nursing. So Mike, you can see we have 3 of the 6 deans assembled here as part of the reactor panel, and one prerequisite was you had to have 2 X chromosomes to be on the panel too. So what I'm going to do is we'll go in the order that they're seated, and I'll ask Janice to go first. And again, the rules of the road, they're heartfelt, extemporaneous, hear and seen it for the first time, their reaction. When Janice is done, we'll go right to Becky, and then we'll go right to Mary. And at the end of that time, Mike, if you feel compelled you would like to react, wonderful. We'll have you come on back up. We might save a couple minutes for reaction from the floor, and then we'll adjourn. So Janice,
wonderful.
Please.
Thank you very much. I thought it was a great presentation, very, very interesting. I think this is about where healthcare has to move, without a doubt. And I guess I just have to show my stripes in terms of being a card-carrying occupational therapist, because this really just resonated so strongly with what we know about people and what you call motivation, or what drives people to engage in meaningful activity. And what is uniquely human about humans is that urge to be effective in one's world. And I think many of the tools that were outlined today, many of the discoveries that you've made about behavior are very on target, you know, very much about what drives people. And so I think it's fascinating, this idea of that really, what about health is about behavior change. one thing I couldn't help but think about is, does this kind of behavior change belong in healthcare? In the sense that, I mean, I think a medical model is very much about pathology and about changing very important results of poor behaviors. But I wonder how much we need to look outside of healthcare and bring in some others to be champions of this cause as well. I mean, I think much of what you're talking about in terms of the mind, body, spiritual ethos is an important triumvirate to bring on board. I think we have to think about methods of customizing approaches. I like the idea that there are a lot of different opportunities for people to think about their behavior change in terms of what they're eating, what they're doing, whether they're measuring their different levels of reactions. But I think there's more to it. I think there's more about assessing what makes an individual feel important every day and somehow customizing that. I like the idea of a menu that people could pull down and say, all right, I want to think about exercise, but I want to think about also making things. I want to think about cooking. I want to think about being involved more in a religious group. I want to think about blah, blah, blah. So I think it's going to be helpful to move this model forward with more customization and much more attention to the individual. I know I'm a member of the Gallup poll, you know, and I love when they send me that little, hi, Janice, we need to hear from you about these very important things. And, you know, they ask me what I think about how President Obama's doing his job, and they ask me about what I think about Congress is doing their job, but they also ask me about whether I think I paid too much for tires, or what I want to think about, what I want to look when I go to the counter to buy a cough medicine, what stands out for me to make the decision. And I can't tell you, I mean, I think I'm a very important person. When that Gallup poll report comes up, you know how it comes up on the radio and it comes up, that's about me. You're reading about my response. So I think there's something about that might be interesting to put in here. That importance of the individual, and that somehow it's not going to just be lists that people react to, but there's going to be a profile that's going to be provided about you personally. Janice, this is about you personally. And as I said, I don't think it's just about the physicality of health. I think there's a lot about the emotional and behavior part of health that we have to pay quite a bit of attention to. So I don't find it at all strange to think that having my hair done or putting makeup on or, well, maybe not mowing the lawn, but would really make me feel healthy, because it's true. I mean, I know that about my own behavior, that when I'm feeling, stuck in the rut, if I get up and move around, I can really start I'm enjoying a day. On a day off, I'm not as motivated on a day when I have to go to work and think about staying home and all the things I could do, if that makes sense. So I think we have to think about people's behavior that way. We have to think about the kind of tools that we want to bring into our toolbox. And I think they might be tools that, as I said, go beyond sort of our traditional ways of thinking. So I think, meditation, yoga, volunteering, caring for others, stroking one's own ego are all parts of the complexity of healthcare.
Wonderful. Janice, great job. You set a high bar. Outstanding. Okay, Becky.
I agree with everything she said. But I guess, first of all, I would also like to echo a few things that Janice said, and thank you very much, Mr. McAllister. This was an extremely motivating presentation, and I think it's worthwhile and very important to commend Humana in this huge effort to realign healthcare with wellness rather than illness, and I think that brings to light some of the points that Janice brought up. It's exciting, and I think if you just went out and talked to all 360 million Americans and put this in front of them, that would possibly raise the level of health literacy and start to change behaviors. That's my biggest concern, I think, in all this, and I absolutely agree with everything you said, and it's extremely exciting. And just what you've done in your own organization is so valuable. And how do we develop the models to scale this up? How do we reach the employers? And that seems to be a very key group. One of the things that does concern me, and I keep thinking, is that we learn our behaviors at such an early age, and I know